We should probably go ahead and get started. So good morning, everyone. Dwayne Spencer again, President and CEO of Habitat for Humanity of Greater Memphis. I'm happy to see you guys all here. Thank you so much. So welcome back to our Health and Housing Summit webinar series. I want to start off by thanking once again the folks who helped make this event possible, our sponsors, the Tennessee Housing Development Agency, Wells Fargo, and Methodist Le Bonheur Healthcare. And to thank you again to our event advisory group. So today's panel will discuss social determinants of health and how these indicators influence their decisions to invest in programming outside of the physical walls of their hospitals. We know that just 20% of a person's health is related to their access to healthcare. The other 80% depends on the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. I was just reading an article from Shelterforce this morning that stated that as health systems take on increasing amounts of financial risk for the health of their communities, they're starting to address these factors, social determinants of health. A recent review found that 57 health systems, which included 917 hospitals, invested at least $2.5 billion in community-based interventions between 2017 and 2019, with $1.6 billion of that focused on housing. So I'm really excited to hear about the innovation and forward thinking of this next panel. But as always, to our guest, continue to use the chat, use the Q&A function to send in your questions for the panel. And of course, feel free to tweet and post about the event. If you do, use the hashtag TN Health Housing Summit or just Memphis Habitat. Okay, thank you. So today's moderator is Angela Mingo, who is Director of Community Relations at Nationwide Children's Hospital in Columbus, Ohio. Angela directs the community engagement efforts of the hospital and works closely with neighborhood groups and civic organizations. She's been instrumental in the implementation of the Healthy Neighborhoods, Healthy Families initiative, which is a 5-pronged approach to neighborhood revitalization efforts on the city's South Side, which is led by Nationwide Children's Hospital. So Angela, thank you for moderating today, and I'll turn it over to you.
Thank you so much, Dwayne, and thank you everyone for joining us this morning for today's session. I'm Angela Mingo, and it is a pleasure to be with you this morning. Now more than ever, a spotlight has been cast on the health disparities of communities nationwide. COVID-19 and the national dialogue on racism, sparked by the killing of George Floyd, have revealed another grave issue in our communities. One that the healthcare sector has witnessed over time, and it has now come to the forefront for the rest of society: the stark health disparities in communities of color and low to moderate income neighborhoods. It's worth noting that our communities of color have suffered disproportionately during this pandemic. The nation's health crisis is further exacerbated by the lack of safe, decent, and affordable housing. If residents lack stable housing, their health is at greater risk. The CDC has responded to this fact by placing a national moratorium on evictions, a moratorium originally set to expire at the end of this month, which has now been extended to March 31st. As Dwayne shared, housing, jobs, education, and safety are a few examples of the social determinants of health affecting neighborhoods and ultimately affecting the health and wellness of communities. Today's panelists will share how their respective hospitals and partners are addressing the root causes of health inequities. Hospitals have been investing in their communities for years. Nonprofit hospitals provide community benefits to carry out their mission and to demonstrate that they are fulfilling their obligation as part of their tax exemption status. But now we are seeing hospitals take a bolder and deeper step towards addressing social and economic needs of their surrounding communities. The Center for Community Investment outlined 6 key steps critical to a successful investment strategy for community health. First is to lay the groundwork. Hospitals are assessing the needs of their communities, educating themselves about neighborhood priorities, and then convening cross-departmental teams to support their efforts. Next, identify a target area and/or population to determine the most pressing needs and root causes. Then, seek and find partners. Reach out to community stakeholders and partners to find out what they're doing to address the social determinants of health. Then, begin examining internally what assets your hospital or organization brings to the table. Is it land, financial support, leveraging of public or private relationships? Begin to determine what projects your organization can bring to your community. Next is to create a strategy. By identifying partners, make decisions about what areas of social determinants to pursue, and begin goal setting with specific targets in mind. And lastly, assess the local landscape. Begin to identify available funding, skills, and capacity of local players, such as community development corporations, community development financial institutions, and in the case of housing, begin identifying housing partners to include government agencies, managed care organizations, and financial institutions to partner with. So today we have an esteemed group of panelists who are joining us who use these building blocks to execute their work of impacting social determinants of health and strengthening the communities they serve. You will hear from our panelists and learn how they are improving the conditions for their most vulnerable populations. You will also hear how hospitals and their partners are identifying shared priorities and leveraging their assets to improve health and housing outcomes. Joining me today is Gretchen West, Executive Director of Healthy Homes at Nationwide Children's, Aaron Murphy, who serves as the Vice President of Community Development Lending at Ohio Capital Financial Corporation, Dr. David Perlstein, President and CEO of St. Barnabas Hospital Health System, and Tom Ozburn, President and CEO at Parkridge Health System. So at this time, I am going to turn it over to our panelists, and I'd like to welcome Gretchen West as our first presenter.
Thank you, Angela. I am going to share my screen. All right. So I don't see the right box. Uh-oh. Oh, okay. All right, great. Sorry. All right. So the mission of Healthy Homes is to build and preserve affordable housing through the provision of 3 programs: homeownership, rental, and home repair services. So over the next few minutes, I'm going to walk you through how we came to be, what we've been able to accomplish over the last 12 years, and where we're headed next. So in 2008, Nationwide Children's Hospital began a massive campus expansion of $780 million worth of development. And that included a new 12-story patient hospital tower, pictured here, and a new 9-story research building. With campus expansion, the hospital began a journey to best, with the long-term goal of becoming one of the top 5 pediatric hospitals in the country. So that same year, the hospital announced Healthy Neighborhoods, Healthy Families, which is a 5-pronged initiative focused on making a significant positive difference for our neighbors and our surrounding community. HNHS seeks to remove barriers to the health and well-being of thousands of families in our neighborhood using a multi-pronged approach. It's a public-private collaboration that targets affordable housing, health and wellness, education, safe and accessible neighborhoods, and workforce and economic development. While the foundation of the hospital's work is the delivery of world-class healthcare, we understand that health begins long before you enter the hospital's front doors. What our doctors and researchers are telling us is that the social determinants of health have a huge influence on a person's health, meaning your zip code can tell a doctor more about your health than your genetic code. And housing and health are very much interlinked. Poor housing conditions can have multiple negative health outcomes. So by improving housing conditions and its costs can provide multiple benefits like a vaccine can, making safe and quality affordable housing one of the most critical contributors to growing up healthy. So as a hospital, we understand how to solve or treat medical conditions, but many of the health issues greatly affecting the children right outside our doors, like violence, infant mortality, asthma, we were having little effect on. Luckily for us, we had a C-suite and a board who challenged us to look beyond treatment and discover new models for prevention. Pictured here are some of the before photos of homes we've rehabbed in the last few years. So rightly so, the hospital recognized that it's not an expert in housing development and would need a community partner to quarterback the initiative. So thanks to some matchmaking by then Mayor Michael Coleman, the hospital began a dialogue with the local Community Development Corporation, Community Development for All People. After some months of relationship building, the hospital and CD4AP co-created a new, larger affordable housing initiative called HNHF Realty Collaborative. And since that is a really long name, we've shortened it to Healthy Homes. So Healthy Homes has a board of directors that's selected mutually by the two groups. CD4AP brings housing experience, strong community relationships through their various direct services, and access to government funding. They are recognized by the state of Ohio and the city of Columbus as a CHODO, which means a community housing development organization. And that means they have access to city and state funding that flows to them through HUD. The hospital brings staffing capacity. They pay my salary and everyone else on the housing team. So I think that's important and nice of them. They also bring capital. Over the last 12 years, the hospital has contributed over $9 million into housing. Lastly, as a huge institution with over 12,000 employees, they bring a fair amount of political influence at all levels, local, state, and federal. So since selling our first home in 2009, Healthy Homes and our partners have gone on to impact more than 400 residential properties in the area just south of the hospital's main campus. This work has been accomplished through three main programs: home ownership, so we buy vacant, dilapidated homes or build new homes on vacant lots, and these homes are sold for less than the cost to build or rehab them to folks at 120% of area median income. We also do home repair grants. From the outset, we knew we also had to help existing homeowners. A revitalization strategy would be incomplete without extending a helping hand to households that had remained through the long periods of disinvestment. Grants have historically ranged from $13,000 all the way up to $20,000 for exterior home improvements. In many cases, these grants provide necessary repairs to older homeowners on fixed incomes. This year, we completed our 100th home repair, and that represents an investment of a little over $1 million. Lastly, in 2016, we realized that we needed to incorporate an affordable rental strategy to ensure that our community remained mixed income. That year, we created Healthy Rental Homes because we got really creative with the name. And as the economy began to improve, private investment was coming back to the community, and oftentimes doing a high-end flip with a high sales price. And so that year, we made an initial commitment to do 75 units over 5 years. In 2017, the executive director of Community Development for All People, our local partner, recruited the Ohio Capital Finance Corporation to assist in structuring a loan pool to support the development of affordable rental housing on the South Side. The fund, which is $20 million in total, so $15 million in loans and $5 million in grant sources, will allow us to do up to 135 units over the next 4 years. The next presenter, Aaron Murphy, is going to talk more about the specifics and the structure of this loan in his presentation. But I think it's important to explain the why from the hospital's perspective. First, this allows us to do more. Our original goal was 75, now it's 135, maybe more. Second, before the loan fund, the hospital was loaning its own money for rental housing. With this fund, we are now using other people's money, and who doesn't like that? And then third, the $1.5 million loan loss guarantee that you see there at the bottom is a way of protecting the bank's investments. Right now, it's not real money. The guarantee only ever gets tapped if things go horribly wrong and we go into the red and can't pay interest to our lender. And at that point, I wouldn't have this job and be here talking to you, but those are our primary reasons and why we think this fund is an awesome way to get affordable housing accomplished on the South Side. So we currently have 70 units in service right now, with another 27 units coming on this year. Our average rent is about $470 less than Columbus's average rent. And because we accept Section 8 vouchers, we're able to serve families with very low incomes. As the infographic shows, over half of our tenants are children, and 92% of them live in single parent households. The Healthy Rental Homes portfolio is giving us more of an opportunity to affect the health of the Medicaid children we cover through our accountable care organization, Partners for Kids. As an ACO, PFK is responsible for the health of over 330,000 children throughout Ohio. PFK gets paid on a capitation rate, so when children are healthy and stay healthy, there's a cost savings for the hospital. So while our researchers have written about the positive effects of removing vacancy and blight on a community's health, what I personally believe is that there's no better way to improve a child's health than by providing them with stable, affordable, and a healthy place to live. It's through the rental program that I believe we will see the biggest impacts on children's health in the years to come. So on another positive outcome as a result of our investments, which at this point is about $40 million, is we've drastically reduced the vacancy rate, which was the primary concern of neighborhood residents when we started our initiative. So when we started, it was a little bit over 25%, to now we're below Columbus's average of 8%. In addition to improving the aesthetics of the neighborhood and removing blight, new research is showing that we're having an effect on health. In a recently completed study published early in 2020, our researchers found that compared to 2 other demographically similar neighborhoods in Columbus, the Healthy Homes impact area trended towards greater decreases in inpatient stays and emergency department visits of children, although these differences were rather small. The community development efforts undertaken by Healthy Homes are still in their early phases. A segregation problem that took over 80 years to manifest will take more than a decade to resolve, even after millions of dollars worth of investment. So some lessons learned. Anchor institutions can be motivated for 2 reasons. The Affordable Care Act requires not-for-profit hospitals to reinvest in their local communities through a comprehensive needs assessment. Social determinants of health are increasingly understood to be drivers of health in communities. Investing in neighborhoods has different types of ROI, so returns on investment. When we go out and talk about HNHF, one of the first questions we get asked is, what's your return on investment for building all those homes? For us, the ROI is more than just reduced medical utilization. It's also about improving our reputation with our community and its leaders, creating a safe place for our patients and staff, along with improving the health of children. Additionally, I've heard from our HR folks that HNHF initiative is a big draw for the recruitment of staff, especially doctors. Doctors understand there's only so much that can be done in a clinical setting. Like, you can write a prescription for an inhaler for asthma, but if that kiddo is going back to a house filled with mold, that doctor knows it's only a matter of time before that child is back for more treatment. providing housing is a longer-term solution that can break the cycle of repeat visits. Third, you are not alone. We found that once other organizations learned about what we were doing and why, we found that a lot of natural partnerships that have helped us leverage additional resources. This is particularly true with financial institutions who are looking for innovative ways to get CRA credit beyond mortgage lending and tax credit deals. In this sense, we've been more than just a developer, but also a collaborator and convener that has helped engage other groups in our community. A community quarterback is key. Community Development for All People has been serving low-income residents on Columbus's South Side for over 20 years. Through their programming, which includes a free store, a fresh food mart, they serve over 20,000 residents a year. Because their direct services they offer, they are able to form relationships of trust and authenticity with folks. CD4AP not only brought housing development experience and funding through the city, but they also acted as a trusted representative of the community. So what's next for us is in 2019, we officially announced expansion into a new neighborhood, South Lyndon. And last year, we started with a home repair program in 2020, and we're hoping to build new homes for sale and rent this year. More to come on that. And that's it. Thank you. And I will pass it back to Angela, I believe.
Thank you so much, Gretchen. You know, it's exciting to hear Gretchen share about the work of Healthy Homes, Nationwide Children's Hospital, and Community Development for All People, and how we've been able to leverage relationships and build capital. And the capital stack has been one way for us to expand our construction pipeline and, in essence, continue to create an environment where children can live, thrive, and be healthy. Thanks again, Gretchen. Our next panelist is Erin Murphy. So I am going to go ahead and turn it now over to Erin, who will talk about the partnership with Nationwide Children's Hospital and Healthy Homes.
Thank you, Angela, and thank you, Gretchen. Again, I'm Erin Murphy with Ohio Capital Finance Corporation. We are a certified community development financial institution and lending arm of our parent organization, Ohio Capital Corporation for Housing, which is a low-income housing tax credit syndicator. So first, I will be giving an overview of OCFC and our work. Second, I'll talk a bit about how we ended up connected with Nationwide Children's Hospital and Healthy Homes to work on the south side of Columbus, and talk a bit about the formation of that fund and how it all came together and how it's structured, and then talk a bit about how that has shaped our current work and our future work in the Lyndon neighborhood. So Ohio Capital Finance Corporation was formed in 2002 as the lending affiliate of OCCH, or Ohio Capital Corporation for Housing. We received CDFI status through the Department of Treasury in that same year, 2002, and began lending, providing low-cost financing for many of the LIHTC affordable housing projects that OCCH syndicates. We provided a variety of lending products, primarily in the pre-development and acquisition side, as well as equity bridge lending, bridging the LIHTC equity into the project, supporting construction hard costs. So in 2012, we also became a member of the Federal Home Loan Bank, and that has, increased access to capital and liquidity for our various lending needs. While the vast majority of our work has been and continues to be focused on affordable housing, over time we began to explore how our capital can be transformative in the broader context of community development. So again, here, just a little snapshot of some of our lending production here. Since 2002, we closed on 675 loans, providing over $725 million in lending, producing or preserving over 43,000 affordable housing units. Again, here's some additional data on some of our lending production over the year. As you can see, over the years, our lending certainly ramped up in size and number of loans over that time. And again, primarily our bread and butter has been supporting lending projects to low-income housing tax credit deals. But we also were providing some lending to some non-LIHTC deals and community development projects. So in 2015 and 2016, Ocfc received 2 grant awards from the CDFI fund to leverage our capital to spur neighborhood transformation. And this directly led to our work with Nationwide Children's Hospital and Healthy Homes on the south side of Columbus. So as Gretchen covered, Healthy Homes had been working in the neighborhood for years, developing primarily homeownership units for sale and providing homeowner repair grants and some single family and rental development. And as they were increasingly successful in the work and additional investment was coming into the neighborhood, they were seeing increasingly the neighborhood was becoming gentrified and a greater need and priority for developing single family and multifamily rental units to really help residents who wanted to stay in the neighborhood stay and preserve affordable housing for the community. So I think it was 2017, Ocfc was invited to a meeting with the Executive Director of Community Development for All People, Reverend John Edgar and Angela Mingo, along with some financial institutions and Tim Robinson, who's now the CEO of Nationwide Children's Hospital, to sort of brainstorm what were some creative ways to bring various sources to capital together to help finance some of the rental housing development that the neighborhood so desperately needed. And as you can see here, what we looked at is, what sort of structure of a loan capital stack would be beneficial for the community in this work. So Ocfc volunteered to take lead on modeling out a loan fund for the neighborhood. And there were a number of factors that made this work an attractive opportunity to foster community development. So in general, the neighborhood was gentrifying, as you can see, which definitely presented the need as well as an opportunity in case things went sideways, homes could be resold, that sort of thing. There was a strong anchor institution in the hospital who was engaged and committed. And we had high functioning and respected development partners at the table through Healthy Homes and Community Development for All People. And lastly, hospital leadership was engaged and at the table in the conversation. And I think this is a really important piece because there wasn't a need for us to go and lobby and convince the hospital at this stage that this was an important piece. They already knew this. They already understood the need for affordable housing in the community and were actively participating in its development. So with all those factors in mind, that made bringing together a fund especially attractive for recruiting investors. And here is a map of the neighborhood for folks who are familiar with Columbus. And this white border here is kind of highlighting the main targeted area where we were lending. And these red squares are indicating where we saw some opportunity to expand the work we were doing already. So the goal of the fund was to assemble, again, lending capital, $20 million fund, $15 million in loans and $5 million in grants to support, which is now 135 single family, multifamily rental units. In the process, we included funds to support commercial development as well. $5 million was set aside to support that work. The goal, as I said, was to attract $20 million in investment that could be offered at a competitive rate, which was at 3%, which at the time was very competitive. Not as much now, but back in 2018 or 2017, that was competitive interest rate for this type of work. But the other piece here was that the term length was set at 10 years, which is somewhere in between a short-term loan and a permanent loan of a longer term. And the repayment structure wasn't set. There wasn't a set repayment structure in the sense that it was non-amortized, but rather would be repayments would be made from available cash flow, which was a key piece, and not many banks were willing to offer something like that. So putting together the fund was a way to reduce risk and provide favorable terms to get these projects done. What made this attractive to investors was the proposed structure, with Healthy Homes bringing together grant dollars as well as OCFC helping bring some grant dollars to the table. We were able to build out 3 tiers of debt that really left our bank investors only about 50% at risk. So 25% of the fund would be funded by grants. 25% would be funded by Affordable Housing Trust, a local CDFI, and OCFC at second and third position. And the remaining 50% would be funded by financial institutions in the first position. First mortgages would be available on all the projects, as well as a backstop guarantee from Nationwide Children's Hospital and a 20% loan loss reserve funded by OCFC. And this is kind of how it all ended up playing out. It took about a year of work to put together the fund, and we ended up closing in 2018 with, as you can see, various banks here included in the first position, either lending directly into the fund or through OCFC as a conduit lender. As the second position here, we had a $3.4 million investment from our local CDFI, as well as some grant dollars and from JP Morgan Chase, as well as through the CDFI fund, we were able to contribute into the position, as well as our own lending capital here. So in total, that's how we reached $20 million with that OCFC guarantee and Nationwide Children's Hospital guarantee, making a $2.5 million backstop here. And here's some other looks at how the fund was structured in general and who's in what position and how, how their contributions rolled up into the positions here. Hopefully I'm getting everybody a good amount of time to check these out. Again, $15 million was set aside for residential loans and then $5 million for community development loans. And what we mean by that is primarily commercial development for small businesses or large economic development projects that would be beneficial to the community in the adjacent area. So here's some of the project pictures of before and after the work that was done. Here's some single family projects that were completed by Healthy Homes. And as you can see, there's some great quality there. And here's an example of one of the small businesses we ended up lending to called What the Waffle, located just north of the hospital in the adjacent Old Town East neighborhood. What the Waffle is a social enterprise that works with women who have aged out of foster care, providing job opportunity and job training as well as other life skills. And it's affiliated with a local community college, Columbus State. And they offer delicious food and opened this year after a long extended rehab and development of their space. And it's been very successful and impactful in transforming lives and providing employment opportunities. Another economic development project we ended up funding through the fund was the Trolley Barn or East Market at Trolley District. This is currently under construction, again in the area that's providing a large format space with space for open market as well as various restaurants and businesses to be located here. It'll be ended up a very large and awesome space for the community. So some of our learned lessons from the project came about is that really communication is key. There's strength in working as a collaborative and making sure we're able to assist one another as we work towards a shared goal. As we ran into various hiccups or challenges, we were able to provide technical assistance to one another or political support in helping moving things along. A big piece at OCCH and OCFC is our internal capacity to provide technical assistance, especially in the property management, asset management side. And we've been able to work with Healthy Homes as their portfolio has grown to help cut costs and make sure that operating budgets are working properly and there are necessary budgets, budgeting being made to make that successful. The other piece is, as my boss likes to say, don't work for free. Out of this process, OCFC took no origination fee and ended up in a third position after a whole year of work to recruit investors and put this fund together. We're happy with the result, but I think if we could do it again, we probably would have ended up taking some origination fee to help cover the upfront cost and investment of time and energy into making this work. But that, again, is a learned lesson. As we moved into our current work and future work, we took the learned lessons and some of the successes we've had in building out this larger fund into our work in Lyndon. In 2019, Ohio Capital Finance Corporation received a pro-neighborhood grant through JP Chase for $5 million. And we put together a collaborative of 4 CDFIs and 6 nonprofits and called it the 614 for Lyndon, with the various goals, primarily being supporting affordable housing development in the community, but as well as having some support for small business creation, health and wellness for the community, and the creation of a healthy food access for the neighborhood. And as Gretchen mentioned, we are now working on putting together the Lyndon Healthy Home Fund to support the development of the first round of 20 single-family affordable rental housing units in the community, particularly in the South Lyndon portion of the neighborhood. And this fund's come together primarily, again, with the hospital taking a very large lead and providing an equity investment, as well as investment from the Robert Wood Johnson Foundation. And our friends at CareSource made a generous investment into the neighborhood and grant as well, supporting the development of these 20 units. And OCFC is also providing lending capital into this. And as we work towards building out this first round, we're simultaneously working on attracting investors and grant providers for a second round of 30 units to reach hopefully a target of 50 units of rental units into the neighborhood as a part of a larger collaborative effort that we're investing in preserving affordable units and larger low-income housing tax credit projects in the neighborhood. So that's all I have, and thank you for your time.
Thank you, Aaron. And it's amazing to see the power of having a community development finance institution at the table through Ohio Capital Finance Corporation. They have been amazing engineers of this capital stack, and the ability to unlock capital at a low interest rate to expand the housing work has been a game changer for Nationwide Children's Hospital. So Aaron, we thank you for your support, and next time around we'll make sure that we take into consideration all fees that Ohio Capital Finance Corporation is certainly deserving of. Thank you so much. Our next presenter is Dr. David Perlstein. I am going to go ahead and turn it over to Dr. Perlstein, who will tell us about the work at St. Barnabas Health System in the Bronx, New York City.
Thank you, Angela. I appreciate the opportunity. Angela and I have worked together, I think since about 2016 or 15. We met each other at a conference, actually talking about a project that I'll be discussing today. So what I wanted to do today is basically tell you about some work that we've been doing over the last several years. And to start that, I just want to introduce who we are, talk about the community, talk about our challenges, talk about some possible solutions to managing those challenges, and then really address some of the future. So this is one way to look at SBH system, or St. Barnabas Hospital. We've been around since 1866, 155 years now. We've kind of redefined who we are and what we do, depending upon what the community is in need of. But primarily, we basically take care of the community and make the investments that are necessary to do that. In the project that we're going to talk about now really has a lot to do with where we are located. We are located in the Bronx. For those of you who don't know much about the Bronx except for the Yankees, 1.4 million folks live there. It's a large part of New York City's population. It's racially and ethnically diverse, but primarily it's a Latinx, Hispanic population. We're not proud of it, but we are the poorest and the least healthy county in New York. Robert Wood Johnson County Health Rankings puts us at 62nd out of the 62 counties in New York. Unfortunately, 40% of the children in the Bronx live in poverty. 61% of those are in single-payer households. The per capita income in my neighborhood in the Bronx is about $14,000. And the sad thing is over 20%, almost a quarter actually of our students have reported experiencing homelessness in the past. This slide is simply to tell you that we're an urban safety net private hospital. We don't have any big brother that can support our operating losses. We have in the past looked at operating losses that were 3 to 4%. COVID has really done a number on us, and we are at this point facing what I believe is probably close to a 10% operating loss at this point. And that's important to say because to tell you as you hear me talk about our project, if we can do this, anybody can. We're an anchor institution. This is a slide that Haney's Hospital Association of New York put out. I was reminded to be careful of acronyms. And it's funny, I used to give a lecture to the residents at the hospital about the use of acronyms. And so I have to remember what audience I'm actually addressing. Anyhow, we have a major impact on the community we serve. And again, that's the purpose of this slide. So we're here because we happen to have a long history of thinking about social determinants and started working on addressing social determinants of health before it became popular. The fact is that our challenge in the Bronx is that it's large, it's diverse, and it's a constantly evolving diversity. Our patients' immigration patterns really reflect the U.S. immigration patterns as a whole. So what have we done? Well, we started working addressing patient-centered care. We started looking at what's called the quadruple aim. It used to be called the triple aim. It was an Institute for Healthcare Improvement program where you try to get better health, better care, lower cost, and more joy both for patients and better satisfaction for more joy for staff and better satisfaction for patients. We're the lead on the DSRIP PPS, and here we go with more acronyms. DSRIP stands for Delivery System Reform Incentive Payment Program. That was a 5-year federal waiver, Medicaid waiver that New York State was granted. And we actually were given the opportunity to run a program called Bronx Partners for Healthy Communities, in which we were given the opportunity to earn significant dollars trying to transform how we deliver care to our community partners. We had about 250 community partners throughout this program, and that would have been community-based organizations and federally qualified health centers and others. And the goal was to redefine who we were and to focus on decreasing unnecessary use of hospitals and emergency departments. That's important, right? Because currently I still make all of my money in general which isn't a lot because we're a Medicaid-based program, but we earn a lot of our funds by discharging people from the hospital, by doing procedures. And what we're saying is that's obviously not a good thing. My background is I'm a pediatrician by training. So it was always very important for me to deliver patient-centered care and to focus on making sure that whatever we do is good for patients and not just for us. So the project that I'm going to talk about today is our health and wellness and an affordable housing project. Obviously, we have lots of partners on this, but it is a transformational project. This project is located across from the hospital on 3rd Avenue in the Bronx. It was built on a previously empty lot that originally was being reserved to build a new hospital. It became clear that there was no way that was either needed nor appropriate, and we looked for a better way to use it. I happen to believe, and I think a lot of us are starting to hear that and see this in the news, that if you want to address a lot of the social determinants of health that stop people from having better lives, I think addressing homelessness is a huge responsibility. And so this was, in fact, a $156 million project. We partnered with a great developer who was mission driven. So the funding that we got originally was, and it continues to support the services for the year, it came through the district program. We were funded by our district program because the goal is to decrease unnecessary visits to the emergency department, which means you have to actually manage a patient population better. The real issue that we're going to have in long term with a program such as this is if you don't have well-developed value-based contracts with payers, this doesn't work. And so we have already had conversations with a number of managed care companies, and they're very interested in dealing with this because I think the evidence is already out there that says that if you do a better job managing patients up front, you can actually prevent the costly expenses. And one of the examples of that is we've been managing a homeless population that are kind of dual diagnosis population, meaning a lot of behavioral health issues. And we've been able to decrease unnecessary hospital visits by almost 60%. Those are expensive patients. So it makes sense for a managed care company who might be on the hook for paying for that care to make a deal. But it really does require also a system that is supportive of care transformation and how care is delivered. And that's why, and we are big proponents of it because the fact is that Medicaid as is doesn't pay the cost of care. So the only way that this works is if everybody has skin in the game. So this is really the structure of our health and wellness center. It's really is transformational for us. It has really two major floors for us on this 50,000 square foot space. It has a urgent care center. It has women's and children's programs, and it has a WIC program. And then the part of the program that we're very excited about is actually the second floor, which has a lot of the wellness space. So that includes a fitness center, a mind and body center, teaching kitchen, and then we also have a rooftop farm as well. So I'm not sure if you lost me for a while when I was talking about the funding, but we will move on from here. So here are some images of while we were doing construction of some of the photos. Right now, unfortunately, we believed we would be open already, and obviously COVID had something else to say. So this was a slide that I took late in 2020. And the good news is that our families all moved in 2019. We have now opened up our wellness space completely. We are looking to improve both qualitative and quantitative measures. So we're going to be measuring a lot of these impacts, including decreased hospital admissions, unnecessary ED visits, improving the health and wellness of the Bronx. But the goal is really to stop pushing wellness on the community and actually encourage more activist patients to pull wellness from us. So COVID obviously has to be discussed in the context of doing anything like this, because it really ravaged our community. Just to let you know, in the end of 2019, our unemployment rate in the Bronx was about 4.4%. At the height, this was in July, we were up to a 25% unemployment, and now we're hanging out around 20%. Medicaid enrollment is up 18%, now 65% of the population. The sad part about our community, and it reflects this social determinants of health issues, was that 90% of Bronx residents who died from COVID had some sort of underlying preventable illness, including asthma, obesity, diabetes, and high blood pressure. When you compare that to the rest of New York City, it was only 75% in the rest of New York City. Blacks and Hispanics were much higher impacted by COVID, more disease, more impactful, partly because of the community and honestly, it's a long-lasting structurally racist policies that had resulted in people living in conditions that are much more difficult to socially distance. So the impacts of unmet social determinants of health is why we're doing this, right? We know that if you have housing insecurity or food insecurity, educational opportunities that are not the same as your neighbors, and now technological disparities, it's really hard to remember to take your antihypertensive medicine. It's really hard to remember that you have to eat right, because maybe you don't have that choice. So this was the original proposal that we got, which was this beautiful, green, lovely thing. It turns out to be a little too expensive for us to do this, but we did as much as we could. These are some images that I'm going to show you as we were putting this together. Inside now, again, I told you it is completed, and we have patients there. This is our pediatric area, our women's health area. This is the gym. This is our teaching kitchen, which is going to be used both to teach residents in the community, but also doctors to better counsel patients about healthy eating habits. That's our rooftop garden, and we are, in fact, both writing what's called pharmacy prescriptions with an F for patients so that they can get healthy foods more easily, immediate access to healthy foods. And we have a farmer's market that we are running once a week on the hospital grounds. We have bees. And so we've had 2 different honey harvests so far this year that we've been both selling and giving away to community members. And the next step, obviously, is to open up all the programs fully. We're going to continue to fundraise, because if we don't have a value-based payment system, we're going to really be challenged with this. We're going to negotiate with our payers to actually pay us in a different model rather than just a fee-for-service model, so that we can continue to afford to do this. We are already exploring a next mixed-use housing project on some land that we own. We are developing new care models, and we're going to continue to do the right thing for the community. So the challenges that we had was solving big problems. Obviously, takes time. It takes energy. It takes money. The Bronx suffers from philanthropic disparity. We don't get a $50 million gift from anybody, because nobody's sister or brother or uncle is going to see their name on a building. So this is really true, I think, across the United States. Politics change. Our groups, which are ethnically diverse and changing, they don't always align except in their poverty. And we actually were all in on addressing social determinants of health, but we made a mistake by not making a deal with payers and with the state early enough. We actually, before we even started the program in New York State, we decreased unnecessary ER admissions from 30% of patients who came into our ER down to 12%. And obviously it means we kept losing money. And sadly, value has to be addressed, and you have to deliver care based on value, especially when you're primarily a Medicaid provider. We still get paid on a fee-for-service, which means we lose money. Resilience is important. but the goal is happiness. And really this, I think, is, this is Mary. She's a volunteer in the organization, been there forever, lives in the community. And she made my day one day to coming by to say hi. So I'll leave it at that. Thank you.
Thank you so much, Dr. Perlstein. Amazing presentation. I know, when we think about what's happened with COVID and New York City being ground zero for the nation, it's incredible to see the work that you're doing and how it's impacting our Black and Brown communities. And so we're grateful to all that you're doing there at St. Barnabas Hospital.
Thank you, Angela.
Very, very helpful. And if others have questions, we will welcome your questions in the chat box and do our best to get to you at the end of our presentations. Dr. Perlstein, thank you so much. We appreciate your presentation. And our next presenter is Tom Ozburn, President and CEO at Parkridge Health System. Tom, I want to welcome you to the panel, and please feel free to move forward with your presentation.
So thanks for having me, and it's been just really an honor and a privilege to hear all the great work that's being done around the country. And so I appreciate everybody's work around this important subject matter. Parkridge Health System is located in Chattanooga, Tennessee. We are a 5-hospital system. We have 3 acute care hospitals. We have 4 emergency departments, and we have 2 behavioral health hospitals. My focus is going to be around our main hospital, or our tertiary hub that has done some of this work to date. I always like to start with the why, or the connected purpose, why we are doing what we're doing. This is Miss Zandra. Miss Zandra is 80 years old. She is deaf. She lives alone. She's a homeowner. And Miss Zandra was contemplating selling her home because it had fallen into disrepair, was unsafe. And so if you can imagine, Miss Zandra on a fixed income, her options were to sell my home and get into a rental situation, or really, have to find other means. And so that's really kind of highlights why we're doing what we're doing. So when I got here, I took a look at our neighborhood and what surrounded our hospital. And there's a beautiful historic neighborhood called Orchard Knob that surrounds the hospital. And but it has fallen in disrepair, and there's just a lot of need there. And so when I think about this, I go back to kind of how I was brought up and what my father taught me, and that is that neighbors take care of neighbors. I remember as a young child mowing the lawn of my elderly neighbors, and when I got into a position that I'm in now, and I look at my neighborhood, I just happen to be, as a hospital, I happen to be the biggest and wealthiest neighbor in the neighborhood. And so, the question is, what am I going to do with that? What am I going to do to address some of the issues that I'm seeing? And so I reached out to the neighborhood association and very quickly became very close with Marvine Noel, who heads up the Orchard Knob Community Association. And what I learned from Marvine was that there had been a lot of talk for the past 20 years about things that could be done and should be done. A lot of studies that were done, but not a lot had really happened. And so I wanted to be that change. And so we started the Orchard Knob Collaborative. Our mission is to improve the health and well-being of the community by addressing the social determinants of health. We feel like we can accomplish this through physical infrastructure, social infrastructure, and healthy living. So that brings me to what makes up the collaborative. The first thing I did was I looked at who was already in the space. So who was spending time in Orchard Knob and who was investing in Orchard Knob. And quickly I found out that Habitat for Humanity was there. They'd done some work there. United Way was there in some of their programs. And then of course, Marvine with her leadership from a community standpoint was there. But what I didn't find was really any guiding focus, guiding all the people together towards one great initiative. And so I started making cold calls, and my first call was to Habitat, and that's where I met Dave Butler, and Dave didn't know me from Adam, and I just introduced who I was, and my question was simple: if I raise money for you, for your organization, will you make sure that it gets spent in Orchard Knob? And the answer was a quick yes. And so my second call was to United Way, and I said, we do United Way campaigns as a hospital. We raise money for your organization. I know you care about this community. I know you care about Orchard Knob. But if I raise money for your organization, will you have a designation within United Way for Orchard Knob for this project? And I even said, I'll become a Tocqueville member of United Way. My organization will increase participation. And so the answer was yes. So that's where it started. And we then got the attention of several other organizations that now are members of our collaborative. One is Green Spaces, one is Glass House Initiative, and then the Chattanooga Design Studio. And I'll talk a little bit more about what each of those are doing in the given space. So really on the collaborative plan, our goals were, as I stated before, physical infrastructure, social infrastructure, and healthy living. And really we have different phases of that. Phase one under physical infrastructure was to improve the quality and the safety of the homes, reducing the risk associated with unhealthy and unsafe living conditions, just like Miss Zandra was experiencing. Social infrastructure was around providing access to resources. So resources that already existed in the community, making sure there's connection there. And then really to try to alleviate some big stressors such as food insecurity, safety, and affordability in housing. And then finally, phase three was healthy living. And that was really as we start looking for our stretch goals, how do we take these first two and how do we take those and transform that into a healthier lifestyle where we're really seeing and attacking some of those social determinants of health. So really, we set some short, middle, and long-term goals. What I heard loud and clear from Marvine Noel, the neighborhood association chair, was, Tom, I've heard a lot of talk, but I've seen nothing, and nothing has been done. And so one of the first things we wanted to do was we wanted action to be seen and felt by the community members. And so the very short-term goal was to award the first 5 homes to be restored. And so we held a big community event. We had all the bouncy houses and the food trucks and invited all the kids in the neighborhood, all trying to build trust within the community. But at that event, we were able to award the first 5 homes. And really established the presence of Parkridge as well as the Orchard Knob collaboration. The midterm goals are really to continue to finalize the scope and the structure of the collaborative, bringing other individuals in that either read about us or see footage of us on TV, and bringing them into this partnership so we can really start attacking the social determinants of health. And the long-term goal, I remember I was interviewed on the news outside of Miss Sandra's house, and the news reporter said, well, Tom, how many homes are you going to do? And I said, all of them. And I remember when the camera was off, everybody coming to me and saying, really, Tom, all of them? And I said, yeah, we're going to do all of them. They're like, oh my gosh, we've got to get to work. And that is our long-term goal. I mean, we want to touch every single home, and it means that we've got to fundraise. It means we've got to get grants. It means that we have to work together and bring these agencies together. But the goal is to touch every single home. And I really think there's nothing wrong with having big, audacious goals. Under social infrastructure, in the short term, it was seeing what's being done right now and making sure it's being utilized. So United Way has a great 211 program. Does everybody know about it? The next is really empowering the residents and the community members that really felt a little bit like all of their previous work had fallen on deaf ears. So it was really engaging them and getting them back to the table in a trusting relationship to see that this was going to really happen. Midterm goals all around determining the appropriate city and county partners, and really filling in the gaps that we identify. And then long term is really to make this sustainable. We Parkridge Health System, we are a for-profit health system. So I know that's a little different, and a lot of people think that maybe because you're a for-profit health system doesn't mean that you have aspirations to ensure your community is taken care of, but we do. But what we really want to do is while we're leading this, we really want to hand this off. We want to be there. We want to support it financially. We want to guide it. We want to bring all the partners together. But at the end of the day, we want to hand it off to the Orchard Knob 501c3 and allow that neighborhood to control the destiny of that neighborhood. We will always be a partner, but that is the future goals and aspirations. Healthy living, really on short term, it's bringing in some of the partners that came to us. Green Spaces is a great organization, and it turns out that they have grant money available to look at the heating and air conditioner systems in all the houses. Someone mentioned earlier about asthma and mold, very prevalent in this neighborhood. So that was huge. The Electric Power Board did a great thing about 12 years ago. Chattanooga became the gig city with all fiber optics. And so, the question to EPB is connectivity in this neighborhood. What are we doing to ensure that this neighborhood is connected? This became very important during COVID times when schools went to distance learning. And if you don't have home internet, what does that mean for your child? And then really continuing on in the midterm, partnering with other local organizations such as the YMCA to look at really taking care of and identifying and solving our food desert problem. There's some great programs that the YMCA has locally here that we can bring into this organization. And then long-term is really convincing developers and convincing grant writers that just like some of these other organizations have been able to do, that this is a worthy investment to invest in this corridor and to build on the backs of what we've established. This is Orchard Knob, just in really what it looks like. This is the map, but it suffers from a lot of the same things that you saw in the Bronx. We have a high percentage of family under or below the poverty level. We have high unemployment rate, family income below 25,000, single family homes. So a lot of the struggles that we've seen in these other markets is also right here in Orchard Knob. And also in the state of Tennessee, this is really a statewide issue. When we look at people being able to age in place, basically nearly 230,000 senior owner households are in low income. This is only projecting to increase as we go forward. And when you look at what makes up the largest expense category for these individuals, you can see that housing is the largest category. And that does not take into account, any type of modifications or income for modifications. So, right up there is transportation. And then you see food and healthcare are all make up that. Also, when you look at the state of Tennessee, 88% of older Tennesseans live in homes that were built before 1980. So you're seeing aging structures with aging infrastructure, aging heating and air, aging electrical, all pointing to what has happened in Orchard Knob. And not a lot of our residents in the state of Tennessee have benefited from modification grants or repair loans. And so, I think, this paints a picture of exactly what has happened to Orchard Knob. So I basically started this with saying, okay, we got to start somewhere. We're gonna raise money. So Parkridge Health System started with a $20,000 donation, a little over $20,000. Our parent corporation, Hospital Corporation of America, then matched that grant. So we got it up to 43. I then basically put phone calls in to all of the organizations and the large healthcare organizations that sit around our community. And I basically said, hey, here's the journey that we're going on. This is your neighborhood too. And we would like you to be a partner and to give. And so this is what funded our first 5 homes. This is how we raised the money. Kind of grassroots, small dollars comparatively speaking, but big changes. And then you can see of all the grants that we have since applied for. So what does this look like with physical infrastructure? Again, this is simple work, but this is the difference between being able to stay in a house and not being able to stay in a house. This is a floor falling through in the bathroom. This is, plumbing systems that work and don't work. This is Miss Sandra's home. We spent $12,000 there. Ellen's home, again, very damaged from a standpoint of functionality, entryways, as well as bathrooms. We spent $14,000. Miss Ellen can now stay in her house. Lawrence's house, smaller project, but again, safe bathroom, one that was handicap accessory. Lawrence can now stay in his home. James's home, again, $15,000, roof repair, interior repair, bathroom repair. James can now stay in his home. Pamela's house, our largest investment to date, full roof, full ceilings. This was completed. Pamela can now safely stay in her home. So we've completed the first 5. We're now to the point of we're ready to award our next 5. And we're also to the point of where we're looking at exterior renovation and streetscaping. Green Spaces has come forward with a green initiative to donate trees to be planted all through the neighborhood. We've got different residential contractors that are willing to donate landscaping. And then we also have funds available to do exterior renovations, so we can start looking at the progress on a go-forward basis. Also, to really get to goals 2 and 3, social infrastructure and healthy living, we continue to leverage our existing partners, but also as a hospital, we know that in the short term, we're going to be part of that solution. So we are currently in the process of building out a new heart center on our campus, and that will be completed in the 4th quarter of 21. And so what that's going to do is that's going to free up a 1 full floor of one of our medical office buildings that is located adjacent to the Orchard Knob neighborhood, within walking distance. Literally, you just have to cross an access street. So it currently houses a cardiac rehab center and a large classroom. And so the future of that is cardiac rehab is going to be converted into the Orchard Knob Collaborative Workout Center. The classroom will be converted into the Orchard Knob Collaborative Teaching Kitchen. YMCA will institute the RX to Good Health program, which will then allow for our physicians to write prescriptions for patients for RX to Good Health, where they can then enter into the workout arena and/or the new kitchen, which will also be a fresh food market. We also brought in a new access clinic with Purpose Point Health. We don't own or operate that clinic, but they became part of the collaborative. And then we also basically did something with our hospitalist program with all of the health clinics that are in and around our hospital. And we put in a direct admit process for any of the federally qualified healthcare clinics. Any patient that they are seeing that needs to be hospitalized can bypass our emergency room and get a direct admission, regardless of ability to pay, into our hospital. We also, through building relationships, the University of Tennessee has an architectural program. The students wanted to be involved as well as the program. And so the students were given an assignment to reimagine what Orchard Knob could be and what the collaborative can be. And all we gave them was basically where our hospital sits and the property that we have that we currently own. And we asked them to go and interview all the residents and ask what they need and want in a community center. And you can see these wonderful students came back with these amazing drawings that they then presented to the Orchard Knob residents, presented to the hospital. The students had a great experience as being students, to be engaged with a hospital system CEO and also a community at designing, getting feedback, putting it into the design. We couldn't be more pleased with this. And And we just received this notification that we have received one of the large grants that we've been working towards. And this grant is all to reimagine the 3rd and 4th Street corridors in Chattanooga. Those are the 2 main streets that bookend Orchard Knob. And the grant was written based on the Orchard Knob Collaborative that we've put together, and the Chattanooga Integrated Community Sustainability Plan. Part of the grant allows for each of the community residents to get a stipend for their work at doing this and coming together as a community. So we just got this news. We couldn't be more excited because what you just saw that those students put together, that sounded like a stretch goal. We now have the ability to have funds to reach that goal. So, you know, I started with a why, and that was Miss Zandra, and I'll end with a why, and that's health disparities. And so why are we doing this as a health system? These are our neighbors. These are our family members. We treat them every single day in our ERs. We eat with them. We converse with them. We have potlucks with them. It's our job to do this. But we can only do so much as an acute provider. So what we do in the ER is we treat acute illnesses. What we can do as a health system with the Orchard Knob Collaborative is we can create safer areas for people to live, and we can change some of these disparities. We can change the legacy. And what I tell my young associate administrators that come to work with me, and that they're all part of the Orchard Knob Collaborative. You know, the work we're doing has a generational impact. Miss Zandra's house that she was able to keep stays in her family. If she would have sold that house, that family would have lost that property. So the work we're doing is generational, and it will have a change, not just next year, but 10 years and 20 years. And so thank you for giving us the opportunity to share our story. And we appreciate being able to do it. And I do want to just say Dave Butler is retiring on me from his work at Habitat. And I couldn't be sadder for Habitat and Chattanooga. I couldn't be prouder for Dave and his family. But if it weren't for Dave and his leadership, this wouldn't have been possible. So Dave, thank you. Farewell, my friend. Thank you for everything that you've done to make this a reality. Thank you.
Well, Tom, thank you so much. This is just a remarkable presentation, and amazing to see how you've incorporated the building blocks of how an anchor institution can engage partners, and going out, making the calls, pitching those questions to United Way to see if they could hold dollars specifically for the neighborhood in your surrounding area. It's just tremendous. And I appreciate your comment about how you're able to keep the residents not only in their homes, but also keep that home in the family, because a lot of what we're hearing during this time of COVID and in health and racial disparities is the challenges of building wealth in communities of color. And we know that home ownership is one way to get there. So we just thank you so much. I know that we are a few minutes over time. I want to ask those of you who still have time to stick around with us. We have some great questions that are coming through. So if you can hang on for just a few minutes more, I want to go ahead and open up the floor for questions. And I'm going to start with a question for Tom, which is first starts out with a comment that Parkridge has been a real catalyst in this space in pushing to create partnerships. And so the question for you, Tom, is what might you say to other hospitals that are thinking about what they can do to impact the communities near their facilities?
Well, it's a great question. I should probably pay whoever submitted it because it's a little bit of a soapbox topic for me. You know, our chamber called me, and I'm on the chamber board, and they called myself, and we have two other health systems in this city, and they said, hey, we've got this consultant, and for $70,000, he can write us a plan about how we're going to attack health disparities. And if you three hospitals will chip in, we'll get the plan written. And my response was $70,000. Do you know what I could do with that in Orchard Knob? Do you know how many homes that I could repair? Do you know how many people I can keep? Do you know how many food programs I can put in place? So, you know, I would just challenge people that, you know, the work is there. The mission work is right here. It's right here in your own community. And you don't need a consultant to tell you that you need to do something. You just need to step up and do it. And so I would just challenge people to be bold, to be brave, and to take chances. We're not going to get it right all the time. And, you know, I'm going to overpromise and underdeliver at times, but it's only by, look, we wouldn't have gotten this latest grant if we hadn't have done those first 5 homes. You know, if we hadn't have proven that this can work, this grant wouldn't have happened. So I would just say to other health systems that are exploring this, join together. The Orchard Knob Collaborative is agnostic. Anybody can join. The more the merrier. Any health system. You know, we all wear the Orchard Knob button, and it's all about Orchard Knob. So my challenge would be for other health systems, you know, if you're thinking about doing something, if you've always had this thought, do it. Go out, reach out to organizations and try.
Thank you so much for that, Tom. My next question is for Gretchen from our participants. The question reads, in one of last week's sessions, a panelist talked about a Memphis program that provides repairs to asthma patients, specifically children, and the effect that the work can have on seniors who also live in that same property. The question is, have you seen something similar in Nationwide's work?
So our home repair grants are made for exterior home improvements. So we would only be affecting the interior if it's a rehab property that we're either planning to rent or sell to a family. So our home repair is strictly exterior with a focus on energy efficiency in terms of windows, roofs, siding, doors.
Thank you for that response, Gretchen. And one additional question for Aaron. The 614 for Lyndon plan is an example of equitable community planning and investment. What did this planning look like as a strategic partnership? And did it require and include community organizing and neighborhood level meetings?
Absolutely. So the 614 for Lyndon collaborative really formed out of an extensive planning process in the community led by the city of Columbus. And it came together as the One Lyndon plan. So a big piece of that, there was 10 big ideas that came and touched on a variety of areas. And our collaborative formed together with a pro neighborhood grant to address 4 of these 10 big ideas. So there was extensive community engagement done on identifying the priorities of the community and how they would like development to be done. And we tried to respond to that. And our collaborative, you know, as community development is messy and it can be challenging. And we've had to adjust to what the communities wanted to see and how they'd like to participate. So we have certainly been holding ongoing monthly check-ins, especially through COVID, where we can't meet in purpose. We've talked a bit, and I'm sorry, we've held these monthly check-in meetings with each of the collaborative members being able to share direct updates to a community advisory board, folks who are not just giving advice, but also helping us troubleshoot and work together to execute, which has been a great opportunity to both get real-time feedback on the work we're doing, as well as when we're running into roadblocks, we're getting assistance for folks who are on the ground doing that day-to-day work. So it's certainly been, community engagement has been key and is built into the collaborative, so much so that our initial group of organizations has grown as we've continued to work to include local organizations to be active participants and executors of the plan. I hope that answered the question. I'm not sure, covered all the parts there, but.
I think you answered it just fine, Aaron. Thank you so much. Next question is for the entire panel, whomever would like to jump in. The question is, what have the hospitals and others represented here been able to do to receive and benefit from the distribution of more than $100 billion in CARES Act funding for healthcare providers? And the participant who posed the question also mentioned that based on reports, some hospitals, mostly rural, have not received any funding.
I mean, I'll take that because obviously we were incredibly dependent upon those CARES Act dollars. There was a while that we were had we not received the CARES Act dollars, we would have shut our doors. So we were fortunate that we also got some funding that was specifically meant for safety net institutions, and that's what really kept us afloat. But we've spent every cent of it. We continue to have expenses that are climbing. Our volumes have not returned to normal. We're doing a lot of telemedicine. And remember, as I already said, we're still dependent on fee-for-service payments, and Medicaid at this point is only covering probably 60% of what my costs are. And the fact is that Medicaid in New York still only pays about 55% of what Medicare pays for, and a lot of hospitals don't even want Medicare patients. So we struggle anyway. But with the increased acuity and the increased costs of PPE, which lots of folks had heard about, and our challenges of trying to compete with others who had much deeper pockets to spend more on PPE, we wouldn't have been here. And in fact, COVID continues to be a major issue in our community. And the fact is that though we thought this would be resolved by now, we still have not returned to normal. Our emergency volume is still about 55% of or 60% of what it was, and our surgeries, our elective surgeries are down. My community is still afraid to go to the doctor, so I'm afraid of what we are going to see from a long-term impact to health. But I think that there have been challenges with getting CARES Act to some communities based on what their reported needs are, especially when you're talking about a hospital that may have 25 beds. And I have heard from colleagues that they really struggled. We're fortunate, again, to be in the middle of New York City. And that we did become as kind of the center of the COVID impact back in March, April, and May. People took notice, so.
We appreciate that response. And Dr. Perlstein, one additional follow-up question for you. You mentioned that you made a mistake by not negotiating with payers on the front end.
Yeah.
So what advice might you have for another hospital or health system if they're trying to put together a project like yours?
I think you bring in payers into that discussion. And in our case, I think we should have brought New York State into that discussion, because obviously Medicaid is a shared program between the states and the feds. And I think had we talked to New York State and said, hey, we're gonna, because we think it's the right thing to do, we're gonna stop admitting Medicaid patients to the hospital at a huge clip. I mean, we're talking about going from 30% of patients that walk into our ED, and we have 100,000 patients that walk into our ED, and you drop it down to 12%. That's a whole lot of money that you miss out on, because hospitals still make their money on discharges. I mean, it's unfortunate. It's unfortunate, but it's true. So I think that, and this is what we're doing now, certainly in terms of going forward with the projects that we have, we are absolutely doubling down on meeting with the payers and meeting with all those folks that actually do have an impact on how I get paid. So you got to do it early. And again, that was, I think, just a mistake that we made because I think our intentions were there. But even today, after DSRIP, and we've talked about this again, and DSRIP is done. It was a 5-year program. New York State was supposed to go into primarily a value-based system. Well, it's not going there. So we're still struggling with a fee-for-service world. And now we doubled down on our expenses on this wellness center. But the fact is that I still believe you do it for the right reasons because you do it for the right reasons. It's patient-centered. It's a better way to spend healthcare dollars. The United States spends 18% of their GDP on healthcare and not enough on social determinants. And I think that's got to be reversed. And if we have to be at the forefront, we'll be at the forefront.
Well said. Well said. Well, with that, I just want to thank all of our participants today for joining us with our panel. I hope that you heard something this afternoon that helps to support your work in the communities that you serve. And I just want to thank all of our panelists who took the time to be here today to participate. I also want to thank Habitat for Humanity of Greater Memphis, and also want to thank the sponsors who've helped to support this year's summit. So with that, I am going to turn it back over to Dwayne Spencer. Thank you.
Thank you, Angela, Gretchen, David, Tom, and Aaron. This was an amazing presentation. It ran over and it was all worth it. I just wish that all of the viewers could have hung around with us a little bit longer to take it all in. This was amazing. I'm gonna go ahead and still share my takeaways. We're already over time, so health begins long before you enter the doors of a hospital. That was one of the first. Hospitals have financial and political influence in their communities, and we need to tap into that. Hospitals already have a mandate to invest in their communities, but will, initiative, and innovation can really impact what can be done via creative partnerships with community development organizations. Anchor institutions can be motivated. We need to better understand their value propositions. Value-based contracts with payers is essential. Care transformation and how care is delivered matters. And finally, as Tom Osborne said, there's nothing wrong with big, audacious goals. I love that sentiment. And the truth is, we at Memphis Habitat live and thrive on that belief. It's why we've done this summit, because we're really passionate about solving the sustainability piece of our aging in place efforts for very low income seniors here in our community and across Tennessee. So I'm just really inspired after this panel. I hope that others are too. I hope to see you all again tomorrow at 10:30 Central as we discuss the philanthropic partnerships. As always, you'll receive an email by the end of the week with access to this week's videos, the presentations, and links to resources we discussed. So thank you for hanging in there, and especially for all of you who went over the hour. We'll see you tomorrow. Have a great afternoon.